Hello, this is Dr. Christopher Wellwood with the Regenerative Medicine Institute, talking to you today about the third most common type of treatment that we perform here at the RMI for regenerative injections, and that would be of neural prolotherapy. Now, our first video included a short description of what prolozone was. The second video was prolotherapy, and today's video is on neural prolotherapy, so you can kind of see the progression there. What this technique specifically involves is the application of a substance right along a nerve that reduces inflammation and normalizes transmission of nerve signals to the brain and the rest of the body, which then allows the normal functioning to occur. Now, at the RMI, we performed both traditional liftoff technique as well as a modified neural prolotherapy that we've developed here, which includes the application of ozone. The types of conditions that we would typically see or treat with this would be diabetic neuropathy, anesthesia or hyposthesia, so a lack of sensation to an area, hyperesthesia, so a increase in sensation, so oftentimes somebody who has chronic sciatica or a loss of sensation on the outside of the leg, or even carpal tunnel syndrome. Those nerve-associated pains can be very easily treated with neural prolotherapy. Now, the benefit of neural prolotherapy is that it is not painful. We do use a local anesthetic to reduce the pain, and it has widespread effects on the nervous system itself, so it basically resets it. The way I like to describe it is if you're old enough to remember, or even not so old enough to remember, those old television tuners where you actually had to get up off the couch and tune the TV, and if it was just off just a teeny bit, you wouldn't quite get a great picture until it got right on the actual channel itself. That's kind of like a radio as well. Well, that is how nerve transmission occurs. When you got an impingement, that nerve transmission doesn't get the signal quite right. And the neural prolotherapy acts as a binding agent and reduces that static, so to speak, and allows normal nerve signal to actually occur. And over a period of time, it actually stays that way for a long period of duration. Now, one of the problems with it is that it does require more frequent injections other than prolotherapy or even prolozone treatments. And the reason is because oftentimes nerves take a lot longer to regenerate than tissues such as capsules or muscles. So if you are suffering from nerve pain or have chronic pain in an area, oftentimes shoulder pain, then this might be a condition that we actually want to possibly treat with you. Another condition we would treat with it would be carpal tunnel syndrome, and that is a type of neural prolotherapy called hydrodissection, where we use an ultrasound and we literally separate the impinged nerve so they can get that normal transmission. Works amazingly well for the majority of people, about 85% success rate on that one. So if this is interesting for you, stay tuned. We're going to continue on with our video educational series. And again, this is Dr. Christopher Wellwood, 509-299-6900. I'll see you soon.